Navy's Surgeon General is back home here in San Diego to talk about the future of medicine in the military. 10 News reporter Mimi Alcala in Point Loma, where she was able to ask him about that.
The U.S. Surgeon General spoke about military medical reform. We were able to ask him some questions about health care, long wait times, and big changes coming to all military hospitals in the United States.
We are changing how we do healthcare in the Navy to meet that, to be one of the providers of choice. So we've put more care options outside the front gate. Despite all the changes that are going on in military medicine right now, what will not change ever is our commitment to those we are privileged to serve.
Vice Admiral Forrest Faison is the U.S. Navy Surgeon General. We caught up with him after he spoke at the San Diego Military Advisory Council breakfast. He says there's no greater responsibility than providing medical forces that are ready, prepared, and present to save the lives of the nation's armed forces. And he says Naval Medical Center San Diego plays a big role when it comes to providing that training. Congress recently directed the Defense Health Agency to take over the military health system, meaning all military medical centers will soon be managed by the Defense Health Agency. Faison says this will be a smooth and transparent transition, and military families won't get a big surprise. The Naval Hospital in Jacksonville transitioned last October. More hospitals on the East Coast are going through it now, and the West Coast is next, including San Diego. Faison says when it comes to military families having to switch health care providers so often or wait a long time for appointments and referrals, the Defense Health Agency is actively working to minimize changes and alleviate those wait times.
The Defense Health Agency is responsible for managing the TRICARE network to ensure there are sufficient providers to be able to meet the needs and to monitor access and wait times. So we rely very heavily on them to do that, and I know they are working very closely with the TRICARE contractors to be able to do that in all the different locations where we have service members and their families, where we ask them to be stationed to do our nation's business.
And the transition here in San Diego is expected to happen no later than October 2020. Reporting in Point Loma, Mimi Alcala, 10 News.